Connected, you may begin.
All right, thanks. Hello, I am Linda Heisman-Powell, and I serve as chair of the Behavior Analyst Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. Today is Friday, August 14th, 2026. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being held remotely by conference call and other electronic medium. Denise Seisman.
Present.
Allison Bell.
Here.
Alec Bernstein.
Present.
Paige Boydston.
Present.
Holly Kramer.
Present.
Kelly Harrison.
Present.
All right. Emily Kessler.
Here.
Pamela Nider.
Here.
Pickwa Lamb Chestnut.
Here.
Nikki Wiley.
Present.
And Alice Zhang.
Here.
All right. I note the following BSRB staff members are also present. David Fye.
Here.
All right. Next, David will read a message concerning this meeting being held remotely.
Thank you, Linda. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely, I state for the record the following information. Access to this meeting is being conducted by medium of interactive communication, allowing members of the public without cost to attend the meeting through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On June 30th, 2026, we sent notice of the meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel, allowing members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the line, but if I hear someone connect and introduce themselves, I will let you know.
Thank you, David. So the meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda, which is approval of the agenda.
A motion.
A second.
Thank you. Was that Nikki? Did you motion?
Yes.
And yep, and Allison seconded.
Yes.
Okay. All in favor? Aye. There you go.
Aye.
Thumbs
Aye.
up. All right. So the next thing, so the agenda stands. The next thing on the agenda is the welcome of a new advisory committee member, Dr. Paige Boydston. So we're all really excited that she could visit. I personally and professionally have known Paige for quite a while, and I think she is a very, very valuable member of this team. She's got her fingers all in behavior analysis on each different level. So she's in the community, she's at the university level, she's training upcoming behavior analysts. She has done research on evidence-based training programs for supervision for upcoming behavior analysts, and has just been very, very involved in the field, and is a very multifaceted human being and professional. So, Paige, would you like to say anything about where you've come from and why you have an interest in being on this committee?
Sure. Well, thanks for having me. I am the current program director for the Masters in ABA emphasis at Pittsburgh State University in Pittsburgh, Kansas. This is my third year in that role, I think, going into my third year. In addition to that, I also, as Linda said, provide services in the community and supervise students. So I supervise Pitt State students and I supervise other fieldwork students that are placed at IBT here in Southeast Kansas. We've actually had a partnership with the Pitt State program since it opened in 2018. So I've been supervising students through the program since it first opened. And then prior to that, I, in addition to doing clinical work in Southeast Kansas, attended Pitt State as a master's student prior to getting my doctoral degree at Southern Illinois University in Carbondale, and got my supervision hours and experience with Linda almost 15 years ago now. And then just moved out to the Southeast Kansas area from Wichita originally for grad school, and have just had clients down here since then. So just had my 15-year anniversary technically. And then when we moved back from Illinois, we moved out to the Pittsburgh area, not just because I had clients, but because I was interested in teaching in the Pitt State program, and it worked out really well because they had an opening. So
Well, we're glad that you submitted your application and that you accepted the offer to be on the committee. So I think
yes.
you add a really strong voice. Does anybody else have anything? Go ahead. Sorry.
Oh, sorry. I was just gonna say I've been interested in a while in getting involved in serving and helping to advocate for good oversight of BCBAs in Kansas, and just missed the deadline last year. So remembered this year. Ran back to my room during the conference and was typing things up.
Yeah. Does anybody want to say anything and welcome to Paige?
Welcome to the team, Paige.
Welcome.
Yeah. All right. Well, welcome, Paige. We're all excited to have you. And if there's nothing else on that, David, do you have anything?
Sure, we can transition to the next item, and I would appreciate well, Paige, welcome to the advisory committee. We've communicated by email, and so it's nice to be able to put a face with a name, and look forward to working with you on the advisory committee. We have a formal training for all advisory committee members, new members, and also individuals who have served previously on the advisory committee. The annual training will be an on-demand training. We tried that last year and had a lot of success with that. So we'll make available to all of you in the near future a recording. It'll probably be about 45 minutes, and it'll cover some of the different basically framework for serving in a committee like this. So it talks a little bit about the role of the BSRB as a state agency created by the legislature with a charge to make sure that the public is protected. And in doing so, the BSRB is charged to oversee the regulation of professionals that are licensed in 7 different professions, and that there is a composite board made up of 8 professional members and 4 public members. And that is through the legislature's creation. The statute does name who serves on that board in terms of the different positions. And then the advisory committees were set up by the board to assist the work of the board. So these advisory committees function by reviewing items the board refers to them, or they can have discussions and then forward recommendations up to the board, but the authority of the advisory committee is really limited to that. So you really work in the capacity of assisting the work of the BSRB, and then making recommendations specific to the different professions. As a composite board, it's really helpful to hear from licensed professionals in all 7 professions, and kind of bring in that expertise in that area of knowledge. And so in the full training, we'll have a lot more information about some of the different laws that apply to state agencies, and in kind of coordination with that, some of the committees that assist the work of the agencies. So all state agencies are required to follow things like the Kansas Open Meetings Act. And as such, any official subcommittees have to also be subject to the Open Meetings Act, the COMA. And while I'll give a lot more information on that during the training, For new individuals to the committee, you may not be familiar with some of the different requirements under the COMA, but I don't want you to accidentally run into problems with that before you go through the full training. So I just wanted to highlight that one of the most important things to know about the Open Meetings Act is that when there's an official meeting of the board or the advisory committees, we will make public notice of that meeting, and we'll post that on our website. We also send that out by email to anyone who's requested to be on that list. There's also the Kansas Public Square, so we put information out there about meetings. The only real requirement is to send it out by email, but as a courtesy, we perform the other different things too. Also, based on the nature of this work, any kind of discussions that are interactive, so back and forth discussions that would involve a majority of members of the committee, that would be about the subjects relevant to the committee. Those things need to happen during a public meeting. So you may be used to working with other groups in different forums where maybe there was a lot of back and forth work done by email. In this kind of capacity, we can't do that. And so even though, people don't always think about an email as a meeting, if you're having back and forth communication, that would meet the requirement of the Open Meetings Act. So if you're having interactive communication and it would involve a majority of members about the work of the advisory committee, that would need to be at a public meeting. So just make sure you don't accidentally hit reply all and start a communication back and forth. And if you have information you want to provide to the members of the committee, one-way communication is fine, but it's probably safer just to go ahead and send it to me and ask that I can distribute it to the members of the committee, and then I can send it out through the agency. So something to be mindful of that. And I know people sometimes, get a little confused on this and think, well, can I talk to more than one person? Yes, the real key on this is when you have a majority of members of the committee. So there's 12 members of this committee. If you have the interactive communication with 7 members of the committee about items relevant to the BSRB or the work of the advisory committee, that's where you kind of run into a problem. But if you ever wanted to reach out to me, if you ever wanted to reach out to the chair, Linda, feel free to reach out to us. And if you wanted to connect with a few members of the advisory committee, that's perfectly fine. When you start getting close to quorum, I would say when you start getting close to about 5 or more, that's when you want to be very, very cautious and make sure you don't run afoul of that. The second thing that's also covered in the training that I'll go into a lot more detail about, more specifics, but just as an early heads up, a lot of the communication that is involved with working with state agencies and also serving on committees that assist the agencies is subject to the Kansas Open Records Act, or KORA. And so, people sometimes think about official records as maybe a formal letter or a business document, but something even as simple as an email or a text message could be subject to the KORA. So when you're having, communications that involve your work as an advisory committee member, just make sure that those are always as professional as you can be, just to make sure that if, those are subject, you wouldn't be embarrassed about something if it came to light. And so, but I think you're all professionals. You probably don't even need that reminder, but I always like to highlight it just to make sure people are mindful of it. So we will be doing the annual training, like I said, that'll be on demand again this year. So I will send out a note when that is ready to be viewed, and you'll all be able to review that. When you do the annual training, feel free to reach back out to me if you have questions, and also let me know once you've completed it. That way I can cross you off my list so I know who has all completed that. But I look forward to working with you on the advisory committee. I think this is a really valuable experience. We definitely appreciate all of the time that members volunteer to serve in this capacity. And we've also seen a lot of advisory committee members, start working with the BSRB in this capacity and then move to becoming board members at some point in the future too. So whether that's a role or not, it is a possibility. But also, I guess one more thing I would say about the role of the advisory committee and the trainings, individuals sometimes will talk about different things like advocacy. And when you're talking about, wanting to make sure that the public is protected and there are good statutes and regulations for the professions, that's a really important part of this process. So reviewing the statutes and regulations that are posted on the BSRB website is a good place to start in terms of getting familiar with some of the guidelines and the rules and requirements. There is some overlap between regulatory boards and also the associations that work with the professions. One distinction I would bring is that the BSRB is created by the legislature. It's created primarily for public protection. Sometimes the associations for the professions, they maybe are put together by members of that profession, and sometimes they exist to promote the profession or for a slightly different purpose. But when we can work together, we always want to do that. And so there's a lot of individuals that may serve on an advisory committee that may also serve as members of an association, and there's nothing wrong with that at all. It's just important in this capacity to remember kind of which hat you're wearing. So in this capacity, just make sure you're thinking of it from the perspective of public protection and the work of the board. But definitely we want to work well with the other associations that assist the professions as well. So I'll stop and see if there's any questions on any of that information, or if Paige, if you had any questions, feel free to follow up afterwards if you don't have any questions today.
So David, one of the things that you said, just to clarify, because we do have a new member on the advisory committee, is that from this committee, you cannot become a member of the board because we currently don't have a permanent spot on the board. And so one of the things that we've been that we have recommended to the board at large is that they consider adding or asking the legislature to add a board member position so that we can actually have, well, I mean, we do actually have, I'm a behavior analyst, but I'm also a licensed psychologist, so I'm serving on the board as a licensed psychologist. I just also happen to be a BCBA, right? And so, so we've several times now have asked the board to put that forward, and the board's willing. It then just becomes part of where we're at legislatively and politically right now with regards to opening up our legislation, right, our statutes, because all kinds of unintended things can happen when you do that. So for right now, you members of this board, unless you're also a licensed psychologist, could not become a member of the board. Correct, David?
Yes, the statutes say specifically that the board is composed of 8 professional members and 4 public. And of those 8 professional members, there's 2 licensed psychologists, 2 social workers, 1 professional counselor, 1 marriage and family therapist, 1 addiction counselor, and 1 master's level psychologist. So when the behavior analyst profession was put into statute, that specific statute with the board composition was not changed. And so the board has been supportive of, adding a behavior analyst to, make the board 13 members instead of 12. And that did go forward a few years back in one of the bills that the board had requested to the legislature. Unfortunately, the health committee removed that item, and it had been recommended past that point, but we have not had a bill before the legislature in the last few years. So I think the board has expressed some support for that. A little bit like you said, it's kind of a matter of, does the board want to request legislation on a specific point or at a specific time? So,
yeah. So, does anybody have any questions? Did that refresh all your memories on that topic and how we can talk and advocate for things and how we need to do them, not in our position as members of this advisory committee or board? And it doesn't prevent us from raising our voices, just not as members of this committee.
I have a quick question for David. So you are saying that we haven't had any legislature that bill actually goes into the process. So like how does that usually happen? Like in terms of actually there's a bill going in with for our particular issue.
Yeah, it's a good question.
Thank you.
And Allison, I saw your hand was up. Did you want to?
I just want to piggyback on that little question because I think now we've been talking about several different statutes that we want to change, and particularly all of the old business. There was a KMAT bulletin I'm sure we're going to talk about at length today. But we have like mini statutes that we want to open now. So like, is it like we have to open one singular one, or can we open all of them? Or like, what does that look like?
Yes. It's a great question. So basically, the work of modifying the statutes is a legislative process. And so basically for something to change in the statutes, it would need to be included in a bill that went before the legislature. Usually that happens by a bill being introduced, it being assigned to a committee, and then it having hearings on one side, let's say the House Health and Human Services Committee. If it gets passed out of that committee, gets passed by the House floor, it would go to the other chamber and the Senate would assign it to a health committee. They would have a hearing on it if they were assigning a hearing to it, and then it would have the opportunity to be run across the Senate floor. And then if it passed in the same version, then it would go to the governor's office. If they made different changes to it, it would go to a conference committee for those items of difference to be resolved. And then it would go to the governor's office if it was passed by the floor. There's lots of different steps where it may not advance forward. But I think your question is, how does that original bill get to the legislature? And a bill introduction request can be made in a committee. Usually the committees have said that needs to come from a member of the legislature. So sometimes if the board would request a bill be introduced, we would talk with members of the legislature prior to the start of a session. We would ask them for their permission to work with the reviser of statutes office. And then if we had, because usually you need to sort of be sponsored by a member of a committee who authorizes you to work with the reviser of statutes office, because that's the group that officially drafts the language that a bill would be becoming. And so that's kind of the process behind the scenes. But if there's associations that would request a bill be introduced, they could follow a similar path. They could reach out to a member of the legislature and ask for the ability to work with the revisers on a draft. And then when the legislative session happened, some of the committees basically will say, we need the bill introduction request to come from a member of that committee. Some will allow it for people to come to the microphone and make a request, but the majority of those introductions usually come from a member of the committee. So there's a few different steps.
So where are we scared that people are going to put their fingers in things?
So Allison, like an example was psychology had put forth a proposed change to some of the CE requirements in their statute. So it opened up the bill, and after all the committee discussion that David was just talking about, the request that they had in there was they wanted to, and correct me if I'm wrong, it was either supervision or ethics. There needed to be 6 CEs. Oh, it's assessment and diagnosis or something. Anyway, there was currently 6 CEs. They were not asking to expand the number of CEs required for psychologists, just to divide that up so that there would be 3 diagnosis and assessment and 3 on DEI, right? Diversity, equity, and inclusion. And the legislature somewhat had very strong opinions on not allowing any DEI measures or proposals or CE requirements to move forward. So they struck it down, but they didn't add back in that extra 3 CEs for diagnosing and treating. And so that got cut to 3 accidentally because the other 3 were supposed to come from DEI. So now the overall number of CEs required for psychologists has been decreased. That's an unfortunate example, but really rather a benign example.
So you say open the bill, is that like exact, so 40-2194, or is that like that entire document?
You have to open the entire bill.
Okay.
And to do that, that's where people that are maybe, don't quite understand what behavior analysts do, that could be their opportunity to get statutes put in place that would not necessarily reflect our community of practice. Was
Yeah,
that pretty accurate, David?
Yeah, and I've seen, when I first started as executive director back in 2020, the BSRB had a bill in 2021, in 2022, and then in 2023. And I would say the bill that was put forward in 2021 involved a lot of different things for the different professions. But basically, by bringing that forward, some lobbyists and some members for different associations talked to members of the legislature and said, let's also include some of these other things that were put in there. And some of them were not some of them were not things the board had an opportunity to review ahead of time or provide feedback on, and one of them actually um, made it more difficult for people to get licensed as social workers. It was a change that was made for that profession, and I think it came down to a misunderstanding about the actual language in the statute. So the following year in 2022, the BSRB put forward a bill in large part to get that language put back in a modified version so that we could help more people get licensed again. Because sometimes there's unintended effects when the things have not been fully vetted. And that's the danger. Because I think the board goes through a process where we have the advisory committees that we can consider things. The board reviews them, discusses them. If they move forward and they've really been worked through, they're usually a pretty good product. But when you have things that just get tacked on because someone gets the voice of a member of a committee and convinces them this sounds like a good idea, if it goes through very quickly, which sometimes happens at the very end of the session, it can sometimes lead to problems that either are a continuing problem or we try to address in future years. But sometimes those efforts to clean things up, sometimes other things get added or changed that just lead to some problems. So I think that's where the issue has been. And over the last couple of years, we've also received just some notes from members of the legislature that said, they're trying to hit the ground running, moving as fast as possible. And if it's not urgently needed, it may not be the best year to introduce legislation. And so we were listening to that. We want to be good partners in this process. So that's been where part of it's come from in the past.
And one of the things, as the committee will remember, that we're interested in is looking at the language in our bill, because our language is more defining our practice, specifically related to autism. And if you remember, it was a bill that was introduced by the insurance companies without any input from the behavior analytic community or the BSRB or anybody else. And we got wind of it, and there was a huge advocacy effort at the time. But what came out the other side was this bill that defines our practice with regards to who is allowed to practice autism.
It's not just practice though, it's reimbursement is what it boils down to, because practice, like I can practice behavior analysis without a child with autism, period, as a behavior analyst, as a board certified behavior analyst. But for the LBA, it's the reimbursement of that service, it feels like, and that feels like an insurance guided thing.
Well, and which, remember, it was put in by the insurance companies to start with. So,
Yeah.
but it specifically describes the practice as it relates to autism intervention. And so your comment is what we've mulled over several times. Can you practice a couple of things? It's not title protection. So can you call yourself a behavior analyst in Kansas without being licensed by the BSRB or having a BCBA, right? And the answer is yes-ish, because our bill is not a title protection bill.
Yeah.
But then you also can't call yourself a licensed behavior analyst or you cannot. Well, that's a question, David. As a licensed behavior analyst, can I go out and represent myself as a licensed behavior analyst and provide treatment for somebody with severe ADHD and attempt
Because
to
our statute is written with just the general service defining what ABA is, but then there's a definition in our statute that's for ASD and what that means, and then it takes you over to where the health insurance or the health mandate was. So we're talking about like 3 different bits of that same bill. We are continuously coming back to them, and now with this bulletin that came out yesterday, I think that I'm not certain that this is a BSRB specific issue, but the BSRB is definitely named in all of this.
What is the bulletin, Allison? Can you?
That they've defined who is allowed to diagnose, and it only includes a psychologist, a family practitioner, a general practitioner, a neurologist, a psychiatrist, a general pediatrician, exempt licensed physician, and an Indian Health Services provider, which means LMLPs, LCPs, and licensed clinical social workers are no longer allowed to diagnose autism. Well, they can, but they can't get reimbursed for it. And their diagnosis no longer allows us to be reimbursed for ABA services that are provided to those children if they don't go get re-diagnosed in the next 2 years. And any diagnosis after September 1 has to be done by those, or they will not be able to access services.
And it only applies to autism.
Only autism.
In having this conversation, can we also, for those that are not, who might be joining externally, discriminate between billable services and physical services? So like David, can you help us identify in the wording of the statute, can we physically serve a patient, which is different than submitting a bill through the insurance company for the service? Are we allowed to see someone without autism? And then can we bill for that? Sorry.
Yeah,
Thank
and
you.
this,
What I was getting at.
yeah, and we kind of had a topic on the agenda a little bit later on, but we can definitely address this now, Linda, if you're okay with us kind of talking about this subject.
Yeah.
Okay.
So what I will do then is suggest that we move our new business up to our current spot and hold the rest of the agenda items. Okay.
That sounds great. Yeah, so there's a couple of issues here, and there is a pretty big distinction, and I have read the bulletin. It was forwarded to me, so I think Holly forwarded that to me. But yeah, there's 2 real issues here. There is what is someone able to do legally under the scope of practice of their license, and then there is reimbursement under the state Medicaid plan. And so in terms of the BSRB, there is
David,
no...
can I stop you for like 2 seconds? Because
Sure.
KMAP, this bulletin will typically guide what commercial and funders are also going to do. Blue Cross Blue Shield is going to follow suit. I am certain of this. So other funders follow what KMAP is doing. So just as an FYI, this is not just like 3 MCOs have made this distinction. The other commercial payers, the other ways that we go about billing services are likely to follow suit on this. And Optum already has tried. So, and I think led the charge on this, if I'm being honest.
Yeah, no, I think this is an area where there really is a need to understand the fine distinctions. And I do think in just reading through the bulletin myself, there's not a lot of nuance there, and there's not a lot of specificity in the distinction here because, yeah, like I said, there's 2 issues here. There's one is what are you able to do legally under the scope of practice of your license? And from the BSRB's perspective, nothing has changed. You know, the individuals who are still able to do the diagnosis based on their scope of practice, based on their knowledge, skills, education, and training, that hasn't changed. So legally, individuals are still able to do the same diagnosis that they have been able to do. I think where the this information in the bulletin is coming from, it's kind of what we talked about at the last meeting under the behavior analyst statutes. There's a statute that has definitions, and in KSA 65-7502, there is a definition of, quote, treatment for autism spectrum disorder. That's a defined term under K. And treatment for autism spectrum disorder says it means.
I can hear you type. Allison, will you mute?
Oh,
You're-
sorry.
I can hear you typing.
So the term treatment for autism spectrum disorder is defined in KSA 65-7502K, and it means care prescribed or ordered for an individual diagnosed with an autism spectrum disorder by a licensed physician or licensed psychologist, including equipment medically necessary for such care, pursuant to the powers granted under such licensed physician or licensed psychologist license. And so they are looking at that definition and pointing to the definition and the diagnosis by someone who's either a licensed physician or a licensed psychologist. And I think the issue in that bulletin that came forward, it basically says that starting on September 1st of 2026, individuals aged 20 years and younger with autism spectrum disorder must receive a diagnosis from a Kansas Behavioral Sciences Regulatory Board, clinical psychologist, or qualified physician. And then it goes out and lays out who is a qualified and diagnostic provider. And it says psychologist, family practitioner, general practitioner, neurologist, psychiatrist, general pediatrician, exempt licensed physician, or Indian Health Services. And then later on in the document, it does say, like I said, the effective date of the policy is September 1st, 2026. It's a 2-page document. I think the real issue here is coming from the perspective of the people that are listed in the header of that document, which is Healthy Blue, Sunflower Health, and United. In terms of reimbursements under the state Medicaid plan, that may be who they are looking for the underlying diagnosis being from for the reimbursements for treatment for autism disorder type services. But the real issue is that the way this is phrased currently, it on its face looks like it's saying these diagnoses can no longer happen from people unless they meet those standards, which from a legal perspective, that's not right. So we'll be following up with them for sure to make sure that this information is clarified, because really that's just talking about the reimbursement under the state's Medicaid plan. Nothing has changed as far as the individuals who were able to make the diagnosis before. And so
David,
it is confusing. Yeah.
and it's even more confusing because of the language.
Mm-hmm.
I'm an LP. I'm a licensed psychologist, right?
Mm-hmm.
If I was an LCP at the master's level, I would be a licensed clinical psychotherapist, right? So just by language alone, that definition should be attached to the LCP at the master's level, because I'm not by title under the BSRB or Kansas statute a licensed clinical psychologist. I'm a licensed psychologist.
Mm-hmm.
So that language, even that language right there, is confuses the issue at hand.
In addition to that, the statute that defines like the health insurance coverage for autism spectrum, which is what I assumed they were pulling this from, and what the BSRB is pulling from our license, says that LCSWs can also diagnose. Now, I'm not advocating for LCSWs necessarily. I'm advocating for the LMLPs, because it's going to significantly. I have an LMLP friend that has diagnosed almost 100 kids over the last 2 years that now their diagnosis is no longer count. And that's just here in Wichita. I'm certain that these numbers are pervasive across Kansas. But two, I know that the mobile clinic that IBT has done hundreds of diagnoses just this year that have also involved an LMLP. And I think that they're having a LP also participate in that. But that may not always be the case. There's only like 3 LPs in Wichita, and there's a couple of pediatricians or developmental pediatricians. This feels like it's just putting up a barrier to the services, and it ties back to now the services that I'm providing, that there was a service provided before I got even touched a client, before I even touched them, before I even knew them, a service was provided to them. They bring me that diagnosis that says that they have autism, and now my services can't actually be billed out because this service over here before I knew them wasn't right. How are families supposed to navigate that? This is a consumer protection thing. If a license, someone that is within their scope is allowed to diagnose,
Well,
a parent
Allison,
is not going to know all of this.
I'm going to interrupt you for a second because I need to be clear. An LMLP has never been allowed to independently diagnose. An LMLP has to have a supervising psychologist. It's the LCP that can practice independently.
And I'm not saying that they practice independently, but not every single diagnosis that an LMLP does has to be signed off on. They have to have the same level of supervision like a BCABA does, where it's like, I don't go to every single session that Nikki is in, or I don't sign off on every single note that Nikki does, but I do supervise her the minimum 5% per month, right? Like, that's the level of supervision that is required for the LMLP, not every single diagnosis. And I think that's the difference.
True, David?
I mean, it says you can diagnose and treat under supervision. I don't think the statutes and regulations for our professions say specifically that each diagnosis has to be signed off by that person, just that you're only able to diagnose and treat if you are under supervision or direction.
Mm-hmm.
For consumer protection, have they even evaluated how many providers meet this standard across Kansas? Because even physicians and neurologists are trying to do what insurance is wanting them, and they're still not meeting what's required or even understand. And they're getting quite irritated.
Yeah.
So now, really, who is even able to do this across Kansas now? Have they even evaluated that data? Because it's going to be even worse now. So for consumer protection and best interest of Kansas, like, how this does not make any sense.
And I think from talking with, because we had a meeting with KDHE and we talked about, where they're pulling this understanding from. And it sounded like in terms of federal oversight and looking back and auditing types of things, the federal government is looking to see is the underlying diagnosis in line with the requirements. And so I think that they are concerned that.
What you said, the requirements from OIG, do we have copies of those? Do we know? Because I know surely we are not the only state that has this.
How many states, David, do you remember from ASPPB that allow master's level clinicians? We're one of the only, a handful of states, Allison. I'm going to say 5. We're only one of 5 states that allow master's level clinicians to practice.
Well, it's tricky because I think, and Linda, I think the number's about 17 now for master's level psychology, but I don't think all of them have 2 levels of license like we do.
Right.
Some they only have a master's level that have to practice under supervision and can't practice independently. So our clinical level or independent level of master's is pretty unique. But we also have, diagnosing privileges for the other professions. I know recently, New York was going through to see if all of their professions would be able to do diagnosis. So there's not uniformity between states with that. But we did talk to the board about this issue at the last BSRB board meeting. Time was limited. We did get approval from the board to put together a working group on this topic so we could continue to have conversations with KDHE. I did talk with the chair of the board, who's also a master's level psychologist and clinical psychotherapist, and he's the chair of that advisory committee, and he mentioned he would like to be involved in this too. So we do plan to kind of put together that working group and have further conversations with KDHE.
Can we make recommendations on who we want to be involved in that? Because I think LMLPs that do practice under supervision but still independently, like Victoria, for example, need to have their voices heard as well. And I think that she would be fine with that. I also think that some of the pediatricians who, one, don't diagnose and are now going to be forced to because the waits for diagnostics are going to be atrocious. But two, like Dr. Allen, I forget the other guy, the other developmental pediatrician's name. I can see his face. He worked for TRICARE forever. Those people also need to be involved in that conversation because it's going to impact their work significantly. It's going to create barriers for families, and that is really disappointing because they're going to go and ask for a diagnosis. They're going to get a diagnosis and be told, oh, but not that type of diagnosis.
Well, and
a
representation
question.
across the state.
Yeah.
It's really important.
And we're
I have a
blessed in
question.
Wichita. We have a couple of people that can do it. I can't even imagine what Dodge City or, I don't know, Marysville, Kansas are going to look like.
I have a clarification question.
Mhm.
So is the bulletin saying that master's level clinicians can't sign the diagnosis, but they can do the comprehensive evaluation and then have the physician sign off on the diagnosis?
They're not allowed to bill at all per the bulletin. They're not allowed to bill at all, basically, is what my understanding is.
Well, but I
Are
think,
those separate issues though, like the billing versus the being able to do the diagnostic? Which I get, like, how are master's level clinicians then going to get reimbursed for that service? Can those master's level clinicians still do the comprehensive evaluation and then send that report to the physician for an official diagnosis?
and that physician and or PhD level psychologist or psychiatrist, all those ones that are named, they have to sign the diagnostic report.
Okay.
Yeah, I mean, this is an area that we need some additional clarity for a few different reasons. And also I think at our last meeting we talked about that there is language in the behavior analyst statutes when it was created as a licensed profession that basically is similar to other professions, but basically it said the creation of behavior analysts as a licensed profession was not meant to restrict the ability of people who were already authorized to provide these services, that they would have to go and essentially get a new license. So those individuals that were already providing similar care under their scope of practice and based on their education and training were still able to go ahead and do different things. And so this was not meant to restrict the practice of individuals who are already diagnosed or are already, authorized to provide some of these services. And so how that factors into this is also sort of a complicated type thing too, and we don't have clarity on that. We did bring that up with KDHE. They were going to consider that, and then we'll need to meet with them again to have further conversations. But I do want to make it clear this is definitely not in any way driven by the BSRB. We were just informed about this. We were informed about their reading of the statutes and what they were considering. And I just received the announcement in terms of this, I think it was yesterday or today. And so we are trying to go through this, but yeah, we would like to put together that working group and then have further conversations with KDHE. Because if they are doing this because they're wanting to be in accordance with the law, we need to have further conversations to make sure that we can provide some clarity. But at least as I'm reading this note, it does seem to state that individuals that don't have this level of license would not be able to make that diagnosis. And from a legal perspective, and in terms of what you're able to do under your scope of practice and your license, that doesn't match with our understanding.
I was in a meeting with KDHE yesterday, and I brought this issue up again. And I wished I'd said the thing about the language, like them saying a clinical psychologist, because if you're saying clinical psychologist, that's in the title of a master's level clinician, licensed clinical psychotherapist, versus PhD, which is merely a licensed psychologist. So, David, so everybody on here, I just want you to know how fortunate we are to have David as our executive director because he's also an attorney. And he has spent the last several years actively going to our trade conferences and doing everything he can to learn about our profession, and is one of our biggest advocates. And so we're lucky to have him on here to try to help us get to a point where we can have somewhat of a voice. And so there's this, he got approval to have this behavior analyst services working group authorized. So David, do you want to talk about that and let everybody know how that works and what the authority is and what could happen coming out of that group?
Yes, so it's not an official subcommittee of the board. If it was an official subcommittee, we would probably set it up and have the formal meetings and everything else. What we were given authority for is to put together a working group, which we're able to operate a little more nimbly with that, but we do need to keep it below kind of a small group of essentially volunteers working on this. And like I mentioned, David Anderson, the chair of the board, who's also a licensed clinical psychotherapist, he's expressed an interest in wanting to be helpful in this area too. So I think probably the next step would be for, probably some individuals after the meeting to go ahead and, if you're interested in serving in this working group, send a message to Linda and myself and just let us know, and we'll review, the individuals. This is something that is still under the BSRB, so we would probably want to limit it to members of the advisory committee, but we could probably use a couple of individuals from the master's level advisory committee for psychology as well. And then we could set up some meetings with KDHE and continue to work on this topic. Separately, I would say, I know some of you serve in associations for behavior analysis, and I don't want you to think that this working group for the BSRB would in any way limit your ability to do things as part of that as well. Because I feel like, for our purposes, we want to make sure that we are clarifying things under the law and providing good information to people in terms of what they are able to do under their license. And also, I think it was brought up, and it is really important that this will, have the effect of limiting care. And we want to make sure that members of the public are protected and getting good access to care. So we do have a role in that, but there's also, in my opinion, probably a role too from the association side, which really does advocate more from the perspective of the profession. And so I want you to know that some of you that serve in that capacity as well, feel free to reach out to individuals at KDHE or other individuals if you think that may be helpful. But we can both be working upon similar tracks.
So I would hope that those of you who have been staying up on this topic or who would like to be informed more on this topic or would like to have a voice on this topic. I know we're all super busy, but this is an important issue. And so make sure if you're interested that you send David and myself an email expressing your interest so we can formally put this work group together. We can pull in our master's level clinicians who it's going to, we're saying it's going to impact our profession. It's really going to impact their profession, seriously impact it, right? And as you mentioned, both Holly and Allison, it's going to have a negative impact on our population. I just had an email before this meeting started from somebody that said they have 6 or 7 clients that they have denials sitting there. They cannot provide services because the MCO is saying that a historic diagnosis by master's level clinician no longer qualifies. And so now they're requiring that those 6 or 7 families go back, quit getting treatment and go back out and get a full-blown diagnosis from somebody in one of those categories. And it's ludicrous. It's harmful. right? That's harmful. That's harmful to those families. And it's counter really to what that bulletin said. That bulletin is not to go into effect until September 1st, right?
It also somewhat mentions the original diagnostic in one of the last paragraphs. The updated diagnosis does not necessarily need to involve a complete eval as long as the criteria and the policy are met and a qualified diagnostician is confirming the diagnosis.
Yeah.
So it
And
suggests they could use their old evaluation for the new diagnosis.
right. And they mention in their page that they mention the ADOS, but they also mention the cars.
Mm-hmm.
Right. So, which, we used to use back in the old days as well, because that's autism specific symptomology. And so, but it's a lot faster than doing the full blown ADOS. Allison, were you raising your hand?
Yeah, sort of. It feels cherry picked to me too, because if we're really looking at the statutes, there's also like mental health parity violations in the rest of the statute that it's referencing. So with the hours caps and the age limit caps, like, it just feels cherry picked to me that this is going to throw up the most barriers, so the least amount of kids are going to get services, and that makes me want to cry. So I had to say it out loud. I'm sorry.
That's okay. I think it makes a lot of us feel like we want to cry because we're back to 2002, right?
Correct. It's giving 2008 when I first started in this field. Okay.
So thank you, David, for being willing to work to get permission to put together this work group so that we can continue working on it and do it in a collaborative way with our master's level colleagues so that we can see if we can move the needle just a little bit, at least, especially in Kansas where we have the dual levels, master's level licensees, and with one by statutory regulation, if that's the right phrase, is allowed to independently assess and diagnose, right? The LCPs.
Mhm.
So anyway, make sure that you send, I already saw a couple of emails come through. Make sure that you send David and myself an email with your willingness to be on this work group. Like I said, I know we're all super busy. And so it might be that you have an interest and you come to the first work group and then, decide that you could submit your concerns in writing for consideration by the work group. I don't even know if that's a thing, David. I just made that up.
No, I think that would be fine, because it would be just one-way communication, so there'd be no issue there. So
Okay. Yeah. And then that way, if you don't have the time physically to be able to commit to another work group, you at least have the opportunity to have a voice. So. Does anybody else have anything to say on this very, very recent devastating topic? I'll take that as a no. Thank you. And I just want to, before we move on, every single one of you guys on here are we can move on. So, having said that, we are going to skip over number 5 due to an administrative hiccup. We are going to approve our last month's or 2 months ago meeting in 2 more months. So look forward to having 2 sets of documents to approve then. And from there, we can now move on to David. You want to give your executive director's report?
yes, and apologies about the minutes. We've had some changes in roles here recently. So we have some people doing some new things, and we're training them on that. And we want to make sure that we get you things of a particular quality because information is really important. So we will have those for you at the next meeting. In terms of my report, I just wanted to let you know every advisory committee meeting, we try to provide updates on items for the most recent BSRB board meeting, also legislative items, and then just general operations updates for the BSRB. Starting with the notes from the most recent BSRB board meeting that took place on Monday, July 20th. And at that meeting, it was an interesting meeting. We actually had something from another profession, but I want to make sure that you're all aware. The BSRB is a composite board, so there's 7 different professions, but the board comes together and works together on all these issues. And so I want all of you to know about some of the work the board is doing for the other professions as well. One of the different items the Addiction Counseling Advisory Committee has been working on this summer has been there was a group of healthcare providers called Acadia Healthcare who had requested introduction of a bill this past legislative session that would have created something called an apprentice addiction counselor. But upon review of that legislation, it really didn't accomplish what the advocates for the bill wanted to accomplish, and stakeholders had a lot of real serious concerns about the scope of practice and the lack of qualifications and training. And so ultimately that bill didn't get a hearing, but it was resolved that the stakeholders and the different agencies involved would continue working together this summer. And so to assist that process, the BSRB put together a few meetings, and one of the meetings was at the June Advisory Committee meeting. We had representatives from Acadia Healthcare talk a little bit about their workforce needs. They presented an alternate proposal, which would have been to make some changes to the temporary student licensed addiction counselor license under the BSRB. Some of the changes they had proposed was right now that student level license has a minimum age limit of 20 years. One of the changes they would have recommended was to remove a minimum age for that level of license. Additionally, they were recommending that the number of credit hours that someone had to have to get that would be decreased from 60 hours down to 18. And then there were 5 different areas for a scope of practice that they wanted to have established in the statute for a more specific scope of practice for what those students could do. We did receive comment and testimony from representatives from the Kansas Association of Addiction Professionals, CAP, and they expressed some very strong statements in opposition to those proposed changes, saying that they did not believe it would be helpful or safe in terms of a public protection standpoint. And so they expressed a lot of opposition to making those proposed changes from Acadia Healthcare. There was also some representatives from the Kansas Department for Aging and Disability Services, KDADS, who talked about some alternative employment positions in the behavioral health field, including things like case managers, peer support specialists, and other types of positions that perhaps could fill some of the need for workforce that Acadia was working with. And then we had individuals also come from the Board of Nursing and talk about the mental health and the technician program under that agency that is primarily being used at the state hospitals, but is being revitalized in Wichita based on them creating that new state hospital in Wichita, or the South Central Mental Health Hospital that's being created right now. So we did receive a lot of information, ultimately based on the real strong comments and feedback from different individuals who talked to the advisory committee. The advisory committee didn't recommend the proposed changes from Acadia. At the board meeting, Acadia came to the board meeting and informed the board about their struggles with workforce and filling positions. Representatives from the addiction professionals also spoke in opposition and expressed concerns from the safety perspective. And ultimately, at that board meeting, the board did not recommend the proposed changes from Acadia Healthcare. But there was actually even one additional meeting. After the Addiction Counseling Advisory Committee meeting in June, they scheduled a special follow-up 1-hour meeting to receive some additional information, and that was in July before the board meeting. So So the board really did take several opportunities to really collect a lot of information to try to help the stakeholders talk to each other with an interest of potentially coming to an alternate proposal by the end of July. And I think where everyone fell was not in total agreement. I think Acadia Healthcare is still looking for ways to address their workforce needs, but I think there was a lot of good information provided to them on some possible routes that they could take to address some of those needs. So I don't know if there's going to be further development, but I'll keep you informed as we hear about that. Some other updates from the board meeting on July 20th. There were some appointments of new advisory committee members, including for this committee, Paige Boydston. There was also an election of BSRB board chair and vice chair that always takes place at the first election following July 1st. And so the current board chair, Dave Anderson, was reelected to continue serving as chair, and the current vice chair, Laura Shaughnessy, was reelected to continue serving as vice chair for the board. One thing that we are trying to make an area of focus on this year is we're trying to become more efficient in the ways that we can function as a state agency. A lot of the work that we do helps individuals applying for licensure, but we're also charged to investigate complaints against practitioners, and we take that responsibility very seriously. As a state agency, we also feel a certain amount of pressure to keep our licensing fees as low as possible. And so it's sometimes a real tricky balance to juggle how much we need for operations while also trying to make our fees as low as possible. And so we don't really have a lot of flexibility to just automatically expand staff based on needs. So we're trying to reevaluate some roles for staff members and change some of our policies and ways of doing things. And so one item we brought to the board at the board meeting is we said, from time to time, we see some violations of unprofessional conduct that seem to be of a technical nature. And we believe that there could be a path that we could resolve some of these in an alternative way. So perhaps if we see some of these dots in a technical nature, perhaps there could be a delegation from the board to BSRB staff to be able to basically allow us to address these with a warning, especially if somebody has had no previous violations, and then we can move them through that process. And then that would save time for the investigators to work on other cases, and it would allow that person to move forward more quickly. And so we also said, when it comes to the more serious offenses, we definitely want to make sure those are fully investigated. We want to make sure that we have all the information we need. So it's not going to affect every type of situation we see. But for some of the ones that, like I said, are more technical, that are more, streamlined, maybe we can address some of these with some standing delegation motions. And so the board was supportive of that. The board resolved to spend some time working on some of those scenarios and then bring those back at a future board meeting and vote on those. But that is something I'm pretty excited about because I think that'll really help some people out when they run into a small issue and will help us become more efficient. We also received permission to create the working group for the behavior analyst services, the topic that we had just talked about. And then kind of last at the board meeting, once a year, the full BSRB board comes together in person. A lot of our meetings are hybrid. So some board members come to the office here in Topeka. Some board members attend the meetings over Zoom, and that works out pretty well. But once a year, the board likes to come together in person and really spend a lengthy amount of time discussing items that need more discussion. And so we've moved this meeting around the state the last few years. We've had this meeting in Kansas City, Wichita, Lawrence, Manhattan, and then this year it's going to be in Leavenworth. And the board is actually going to be starting that meeting on Sunday evening on September 27th, and then it's going to be all day on Monday, September 28th. And this is the only meeting that we don't broadcast on the YouTube channel because by moving this meeting around the state, we have variable levels of technology. But this will be an in-person meeting open to the public. So anyone who wants to attend that meeting is welcome to do so. It'll be at a hotel conference room in Leavenworth, September 27th and 28th, and we'll have more information on that on the BSRB website. Moving to a couple other items. I did provide the board with some general information on just kind of updates. We had wrapped up fiscal year 2026 and we are now in fiscal year 2027. 3 board members were reappointed to the board for a second term, and that was Richard Nobles, who's a licensed psychologist, Cynthia Schindel, who's a social worker, and Jim Kilmartin, who's a public member of the board. I also inform the board, in some of our outreach that we do, we talk with different groups of students. It's rare that we speak to a lot of students during the summer, but we did have a night class that we talked to recently at the University of St. Mary's, and we talked to them about the application process and unprofessional conduct. And so we are continuing to try to reach out and build more connections with groups of students and also with school programs. To that effort, this past week, we set up 2 different meetings with representatives from a couple programs that offer both psychology programs and also counseling programs. And we've had some individuals that have attended one and have applied for the other type of license. And there are some programs that are designed to meet the requirements of both. There's some counseling psych type programs, but there's other programs that are really specifically designed to meet the license requirements of one. And so we want to be helpful to the individuals who apply and treat them consistently and help them get a quick decision. But we also want to be in alignment as much as possible with what the school has designed the programs to be. So we set up meetings, met with individuals from Fort Hays State, met with individuals from Emporia State. And I think we're in a really good position, and we're trying to have more and more communication with the schools and the programs, just to kind of be in alignment if we can. We don't have any control over what schools offer, but it's helpful for us to hear what their goals are. And then if their goals are to meet certain standards, we want to make sure we're communicating with them whether their programs actually do meet those standards as we review materials from applicants. And then last, one item I just wanted to highlight for you all from a legislative perspective. You may recall about a year ago or so, we brought a number of regulations to you to review as a group. We went through and we had staff members look and make some proposed changes to some of the regulations. And that was in preparation for a big project that we needed to submit to the legislature. We had a report that was due to the legislature by July 15th, and it was submitted at that time. It meant involving all 166 regulations for the BSRB, and for each one of those regulations, provided an update to the legislature. Is each one of these regulations necessary for implementation of state law? If it's not, is it a helpful regulation? And then also, if it were to be revoked, what would the impact of that be? And so it was a massive report, about 20 something pages, but we did get that submitted and turned in, and I've received some positive feedback since we turned that in. If we do get asked to present information to the Joint Committee on Administrative Rules and Regulations about that, I'll provide an update to you. But as of right now, I think that's closed. We will be asked to do this every 5 years. So probably in a few years, we'll start making preparations to do that again. But while it was a lot of work with all the committees, I think our regulations will look better once they're all through that process. And just as a note about that, the state made a big shift in terms of its regulation review process. It changed from a paper-based system to an electronic system called ESPR. And moving to the ESPR system has been a little complicated, and there have been some delays in terms of some of the regulations moving through based on the conversion to that new system. We have some that are in the pipeline and moving forward, and we're hopeful to get some information on when we can start putting those out for public comment, hopefully later this year. So with that, I'll go ahead and end my report and see if there's any questions.
Just to refresh everybody's memory, that one of the topics that we talked about earlier was opening up the bill, right? That is different than the regulations. So you have statute. David, do you want to define it? You would probably be more eloquent than I, defining the difference between statute and regulation.
Sure. If you ever see the term KSA, that stands for Kansas Statutes Annotated. And a KSA is a statute that means that it is something that has gone through the legislative process. It's been passed by the legislature and signed into law, usually through governor's signature. And then that is either amending an existing statute or it becomes a new statute. And anytime you want to change something in statute, the only way for that to change is for the legislature to revisit it, strike it, or for the courts to basically rule it unconstitutional. That's pretty much the only way that those statutes get changed. However, within the authority of the statutes, agencies have some authority to kind of spell out how these things can be implemented. So for example, in the behavior analyst statutes, if you take a look at those, there's a few of them that basically say this statute authorizes the board to create rules and regulations on unprofessional conduct of licensees. And then what happens is the board will have discussions about what would constitute unprofessional conduct. And then instead of bringing that back to the legislature to go through the bill process again, there's a different process where the state agencies draft those up. They're reviewed by the Department of Administration. They're reviewed by the Attorney General's office. If they have concerns or think it goes above their statutory authority, they will kick it back and basically say, you have to change this or modify this. But once it meets that approval process, then you put it out for public comment for 60 days. You go in front of the legislature in terms of the Joint Committee on Administrative Rules and Regulations. You answer their questions. You receive feedback from the public, from the legislature. And then at the end of the process, the board has a decision to either adopt those regulations or to make changes based on the feedback, or to basically decide not to adopt them if the feedback has been very negative and the board changes its mind. And so it's a process that allows for some changes to be made without having to go through the bill process. It can be a quicker process at times. At other times, if things get returned or modified quite a bit, it can bounce back and forth. But it doesn't involve going through the statutory process with a bill. So the bill process is very much defined to the first 3 months, 4 months of the year, because that's when the legislative session happens every year. Regulations can move through the process at any time of the year. So it's some differences there. But also, if there's ever a conflict, the statute trumps. So if the regulation were to go above the authority of the statute, it would be invalid. If it were to contradict it, it would not be enforceable. And so they should be in alignment, but the regulation is more helpful sometimes when people are trying to understand, I want to meet the statutory requirement, but how do I do that? And one example is sometimes, let's say for a fee, the cap of the fee would be established in statute, and it would say this fee can be no more than, let's say, $100. And then the regulation, the board would say, we want to set this fee at $50. And then if we needed to revisit that, we could go through the regulation process and say, well, let's change this from $50 to $60. We're still within that cap of the $100, but we can modify it based on the regulatory process.
So you can be a little bit more nimble with your regulations. So, and yeah, so one is law and one is interpretation of the law, right? Yeah, and how we're going to enforce it. Does anybody have any questions for David?
I do. Why didn't behavior analysts have any regulations listed on the board's website? I just went to go look at, like, what's all of our KARs versus KSAs, and we don't have any.
There are some regulations. They are yes. So if you go to the BSRB website, there's a drop down that says statutes and regulations. And then if you hover over to BSRB regulations.
Oh, I was on the proposed regulations. There's no proposed regulations.
Yeah, if we put regulations out for public comment, then they would be posted under proposed regulations. Yep. But if you go to the ones that just say BSRB regulations, that one lists them in order of the profession, and in alphabetical order, they'd be right underneath the addiction counselor. Yep.
I was looking at the proposed ones, but everybody else, why does everybody else have proposed regulations and we don't have any proposed ones, David?
Let me take a look.
It says none at this time.
Yeah, oh well, and I think, to be honest, this is probably a page of the website that could use some updating, because these were proposed.
Oh, those are 2024 at the top. Okay.
June 21st of 2024. So these ones have likely all gone into effect with some minor changes when they reached the end of that process. But these were a little bit in the past. So.
Okay. I'm less annoyed. That's fine.
Good catch, Allison. David, I think we can get your administrative assistant working on it.
and sometimes we do leave those up for a little bit. It's probably
for 2 years, David. For 2 years,
it's probably time for us to take those down. But yeah, if you were to click on any of those, they do actually show the markup So they show how it was before with the proposed changes. So sometimes when something changes, it is helpful for someone to see, okay, this was modified. And it also has some stamps from the different approval process, like the Department of Administration and the Attorney General's office. So that does show that they were reviewed and approved. But yeah, I think in this case, probably we're ready to file those in our historic type stuff.
So, David, I have a question too. We did all of the different professions did quite a bit of work on cleaning up our regulations.
Mhm.
Are all those going to be posted on there for comment?
They will. They will.
All right. So all of that work that we did will be posted out there for people to look at and make public comment on. And I like to think of us as very active and engaged professional behavior analysts. But I'm always surprised at the response rate that we get to our surveys or requests for people to review, because it's very similar to other professions. And that always surprises me because behavior analysts are a very vocal group of professionals. So we need to make sure that when we have something out there for review by other licensees, licensed behavior analysts or LBAs, LABAs, that we actively get them going out there and looking at them, right? So that it's truly representative of the field and those licensed professionals in our field.
I do have one more question, David. So you said that the current the current BSRB regulations are defined by. Oh, never mind. Just kidding. I just needed to scroll more. I'm so sorry.
That's okay.
But
Maybe
this-
you can run for office, Allison.
But this is good. I mean, this is good practice because when people are talking about, how to be, go in depth or a little bit further as an advisory committee member, we always recommend, becoming familiar with the website and looking for different things. And we are trying to put on FAQs to answer some questions that people ask from time to time, and list things in a way people can find them. So we do post materials for meetings on there. So if you ever do find something where you have a question or think something is missing, I mean, sometimes something might have accidentally gotten deleted or changed, and so we want to make sure that gets put up. So if you do have questions, let us know.
So, David, whatever happened to that one module that we were going to create for statutes and regulations? And remember that you
The
thought
CEU.
about the
Are you talking about the CEU we talked about doing?
Yeah,
Yes.
whatever happened to that?
So we had a really difficult time finding a good way to implement that for the number of people that we have licensed. We still want to move forward on that, but we were having difficulty finding a vendor that we could do the survey in a way that we could keep track of the responses to verify attendance. That would actually be able for us to have over 1,000 people, because for the social work profession, we have probably over 8,000 social workers now. So we found some that were suitable for small groups of people that would allow us to track the information. But we didn't find the right vendor that could do the number of people we needed. So we still want to move forward on that. We just kind of put a pause on that while we were still looking at vendors. So
You want to refresh everybody's memory about what the content of that tutorial was going to be?
sure. So the board had a conversation about should there be a jurisprudence requirement for licensure. In some states, there is sort of an additional examination or a process where it's basically, so some of them do it like an exam that you actually pay a fee and a third party administers it. Some of them have more of a module that you work through and it's maybe a no fail type thing, but you answer questions and it's to demonstrate that you are knowledgeable about the laws specific for the state that you're going to be practicing in. And in some states, they require it every few years. And so it talks about, how many hours are required for continuing education? And do you have any special categories where you require a certain number of hours of ethics or something? Or, how early can you start to the process of reviewing your license? Or, maybe what happens when your license expires? Or does the board have an inactive status for licensure or something like that? And you can also get into topics like unprofessional conduct. And so it helps people be more knowledgeable about those different types of things. When we looked into it as the board didn't want to make something an additional requirement for licensure, because right now, especially with workforce, we're trying to help people get into that process without having some additional restrictions. But we did really value people understanding that information. So we came up with the concept, instead of charging a fee and having it as an additional test, what if we offered this as a continuing education opportunity? And we did it sort of in a format where we went through all the questions together, almost like live trivia in a sense, where we had people log in, do the questions live, and then we would cover all the same information, and we could track the attendance by them answering the questions. And by the end of it, hopefully we could motivate the behavior by doing it that way. And we could give people a free hour of continuing education for participating. And so we got a lot of positive feedback on this, and I'm still really excited about it. It's just in terms of going through and looking at different possibilities, we kept hitting little roadblocks. And so we had to kind of pivot to some more other time sensitive items. So it's still something I want to move forward on. It just got, unfortunately, moved down in priority, but it's still something I want to move forward on.
And I think it's a wonderful idea, because I think it's important as a new profession, relatively new, that our offspring, those that we're raising, understand what the statutes are and the regulations are, and what are the laws surrounding their behavior as professional behavior analysts, right? And the idea that David had to be able to offer this in such a way that it was engaging and increase the probability that people would take that tutorial. He learned that at APBA. So his very first conference that he went to for professional behavior analysts, he came away with that idea. And I was like, see, it works. So I would like to hopefully get that in place for us.
Are
So,
we the newest BSRB license? Like the most newest and the newer?
Yeah.
The most recent profession.
There you go.
So the most recent license would probably be that student temporary licensed addiction counselor, but the most recent profession, because I believe the statute passed in 2014 and licenses started getting issued in 2016, if I remember right.
Yes.
Yeah. And so yeah, we're the young ones, but we're the ones that are experiencing one of the highest growth rates in terms of licensees. So, our trajectory is very steep compared to the other professions in Kansas. So it's kind of cool watching us grow like that. I don't want to be a negative Nelly and tie it back to
I would say cool is not the word I would use. Terrifying is the word I would use.
but it's there's a lot of energy in our field, and I hope that we can take all that energy and channel it to be able to continue to advocate for and have a voice for effective intervention for everybody, not just autism, but that's a future discussion, which could factor into two pieces on our agenda. Under old business, category A, continued discussion on title protection for LBAs and LABAs, but that would require opening up the bill, and it could factor into 8B discussions for topics for the rest of 26 and 27. So before we move on to the next agenda item, does anybody have any questions for David on anything that he had in his report or what we've been discussing? No? All right.
And Linda, I'll share one thing. This is something that everybody can access from the website as well. But since we were kind of looking at a few different areas of the website, I'll share a report we do for the full board every other board meeting. I think it's interesting given our conversation about the growth in your profession. This is a document that we track and share with the board every couple months. It looks at the change in number of permanent licensees under the board. So we know there's a lot of other people in the process that are applying for licensure. What this reflects, each one of these different lines is a different license type. And going back to July of 2015, it shows year to year the change. There's a little kind of weird item in the table based on the pandemic because during a lot of that time period, licenses just didn't expire. So the numbers are not the best during that because of that. But basically, looking at year to year up until the last year, which we did it every other month, the growth in your profession, like Linda said, has been very strong. And the number of licensed behavior analysts is up to 684 as of the month of July. So we are seeing steady growth there, and I would only expect that to continue. So
Yeah, and if you look at it, I mean, the biggest is the social work area, but you know, we're closing in on a lot of these professions, and we've surpassed several of them.
We've surpassed some that have seats on the board.
Yeah.
now, if you look at
I'm never going to give it up, David. I'm never, all 8 million years you're going to know me.
that's
Never.
okay. Page 2 is where you have each of the different license levels rolled in together for the different professions. And so this kind of combines all, like, let's say the bachelor's, master's, and clinical social workers all together. And so I said 8,000 social workers. It's closer to 9,000 now. But 1,000 licensed psychologists, 9,000 social workers, 3,200 professional counselors, and then so on and so on. And behavior analysts were the smallest group, but as of the last year, the smallest group now is the master's level psychologist. So
Yeah. And so master's level psychologist, and we're closing in on total psychologists, right? I mean, we're only, if the growth holds, we're only what, a year away, two at the most, of catching up to the licensed psychologists in the state of Kansas. That's crazy.
And LPs or LMLPs and LCPs are probably going to continue this little downward trend they've got because they can't bill for anything, at least not for autism. They can still do other diagnoses.
Yeah, it's not autism. So I think so there's that. That would be, because we are very data driven. You know, that would be nice to look at periodically, like our growth rate. And I think that people on here that are in academic programs like Pam and Paige and Piqua, is Piqua still on here?
I believe they had to leave at 2. I think Alice and Piqua both had to leave.
Yeah. Like would probably be really interested in those growth rates and what that means for your programs and stuff. I think that would be good information to share. The other question I have, which is really not on here, would come under old business. If you all remember, we did a survey of behavior analysts for things that were important to them, and you know, asked several questions on several different topics. So David, are we planning on doing that again?
Yes. So we don't really have the capacity to do that every year, but we're planning to kind of do a follow-up on that. We had talked about maybe every 3 years or so,
Mhm.
but if there's more targeted questions that you would want sent out as a committee, we could definitely do that in between. And the full report for the behavior analyst that was put together and posted on the website under resources and then publications. And there's a survey report for each of the professions on that page. So
And so this is elevating 8B before some of our old business items, if you guys are okay with that. And is this being recorded?
it
Yes,
is.
it's transcribed. One of the things maybe that we could work on is coming up with a list of questions that we would want to include in a future survey for our field, and start that now so that when we get to the point where the BSRB has the bandwidth to distribute a new survey, we have something already crafted that could either be built into the survey or it's an add-on specific to our field. What do you guys think of that? So that we can be responsive to the protection of people that are consumers of behavior analytics services in Kansas. I think in light of current and recent events, I think surveys would be one potential topic. And so, all right, so this is just a question. Are we allowed to send surveys to our licensees and ask them to distribute them to their families to respond?
Well, so what we had done in the past is we have information on all of the licensees, and we can send those specifically to licensees so that we know it is coming directly from people that are licensed behavior analysts or assistant behavior analysts, as opposed to sending out a general link that someone could put on a message board and then you don't know who's responding back to it. So that is always the risk. If you were to have something where it was just a general link that people could distribute, it's hard to verify that the information is really coming from the audience that you hope it's coming from. But that is a possibility. We could do that.
I just think that since our mandate is the protection of the public, that we're getting information about the providers of the service, but not about the consumers of the service. And the consumers are the ones that we're mandated to protect. And so how could we get responses from them in such a way that that the data are meaningful and valid, but doing it in such a way that it's not a heavy lift on our part, but I don't know, what do y'all think of that idea as a topic of conversation for 26 and 27?
Yeah, I'll defer to the members of the committee. I'm kind of curious if people have thoughts on that one.
I think that would be a great idea, Linda. I really like the push for involving folks in what we're doing and targeting, if it's possible, the families that they're serving, since they are technically who we are working for and trying to protect.
Thank you, Alec. I agree. Anybody else? If two of us think it's a good topic, do we get to put it on the agenda?
I agree.
You can put me down as a third. I do think it's probably going to be two different surveys, if you will, that you need to address the two different stakeholder groups. I think working out a plan for how to do it and how to do it efficiently and effectively is a good idea for the upcoming discussions, particular with respect to the surveys of behavior analysts. I'm just thinking, trying to plan for maybe like a recurring with a standard interval administration might be helpful just so that professionals kind of come to, maybe that's what we do already, but so that it's sort of predictable that, oh yeah, survey every 2 years. If I have something to say, I'll do it rather than a reactionary, we're doing a survey to address something because I'm not a, yeah, period. I just think a recurring one would have additional benefits than a reactionary one.
I also agree it would be good to get data from families. I think it would be worthy, though, to investigate whether we need an institutional review board approval for that type of survey, particularly if we're collecting data on children. So maybe we could just have somebody look into that, David.
Okay.
Nice, Denise, nice bringing it back to protection, which is what the IRB HSE is designed to do, right?
And the bane of my existence too, but yes.
And Pam, I like you.
Sorry, to reiterate Pam's point, I guess to give some relie to Pam's point, creating a plan for us so that we know how we're going to evaluate those. I really like the recurring every quarterly, every year, every 2 years, whatever it might be, but having a system in place for how those data are going to be evaluated and how we'll disseminate them will ensure that we're being efficient with our time, and folks that are filling out the survey contact the outcomes of that and know what we're going to do because of those outcomes will be great. And I'm happy to help troubleshoot ideas if we do that.
Thank you, Alec. That was at least one of them was the point I was going to make as well, in agreement with Pam, that it needs to be like recurring, that we're gathering information. And then to speak to your point, what are we going to do with the data that we get? Because I don't want to collect data just for data's sake. It would be nice to collect some of those data and be able to put it on the website, right, David? But if we get a bunch of people that are saying the same thing, then as an advisory committee, it would then be our responsibility to look at the data over time and synthesize it in such a way that we can make recommendations to the board.
So just as a reminder, I think most of you were on the advisory committee when we developed the last survey, and we reviewed each of those questions together as a committee. As I kind of tell people about the survey, I kind of usually refer to it as two main categories at a very, very high level. One was collecting workforce or demographic type information, and one was sort of targeted at looking for issues and then collecting feedback on what those issues were so we could kind of brainstorm as far as problems to be solved or fixed. And so the part of it that looked at a lot of the demographic or workforce kind of things asked people, do you work in private practice or education or in a public setting? What counties do you primarily practice? How long have you been practicing? We also sort of said, how many hours do you provide in-person services per week compared to some of the other roles? We asked people as far as the prevalence of in-person versus remote or telehealth type services. But then we also asked people, if you maintain a license, do you still provide services? And if you don't, why don't you currently provide services with your license? And we also asked people, have you experienced any issues with supervision in the last few years, and any issues concerning remote practice or telehealth type practice? And are you seeing any issues out in the field in terms of areas where people might need more education, training, or continuing education? And then we kind of had a broad couple questions towards the end where we said, as an advisory committee that assists the board, we're trying to make sure that the public is protected. Are there ways in which the board could better protect the public, basically? And we kind of gave some opportunity for general feedback. And so we collected a lot of really good information. The survey report summarizes that information, but we also really tried to leave the open field responses as well. So we have great information in terms of some of that is multiple choice. If we collected that with some frequency, it would be easy for us to kind of put the numbers side by side as long as we ask the same questions. For the other ones, it might be a little more challenging because some of those answers were all across the board in terms of what people thought. But you could still do an analysis, and who knows, in a couple of years, maybe AI will be so evolved that we will trust and want it to do some of that help for us as well. So I don't know, but we also asked about AI in the survey, so that is a category too. So.
Which is continued discussion, which I think one of the things that we did ask was about supervision, and that was also one of the regulatory lines that we were looking at. And so and we did not do this, but what were people saying regarding supervision practices on their survey responses? And did that guide our recommendation when we changed that regulation on supervision? Right? I don't think we took any of that into consideration, but that would be in my opinion, a good idea moving forward, is if we took the data that we're collecting and we used it to help inform our decision making as we're looking to update any of our regulations or recommendations to the board. So, anybody opposed to starting to put together a process like that this upcoming year? No? All right. There's another new topic for 2026, the rest of 26 and 27. And then, so then just bumping back to old business, we only have 10 minutes left. And I'm sure there's other topics. We could just keep that on for next time as well, David, on our agenda, because I'm positive other topics are going to come up with the current climate that's affecting our practice. So I'm pretty sure other stuff's going to come up. But
And I did want to say, sorry, Linda, I did want to thank Alec he had sent me an email with a list of some contacts in different states. And so I had reached out to individuals to collect some more information on possible title protection laws. And so I'll have that for you all at the next meeting. And as far as the AI, in the licensed psychology meeting earlier this week, we had another document, or I think, Linda, that you had provided the CLEAR document on AI. And so that's attached in your materials today. So we can talk about that more at the next meeting if you want to.
I think that the topic that I've talked to Linda about, I know for certain, I've talked to probably everybody about it. I don't know, I just be yapping sometimes. About TCMs and their role in behavior analysis, writing PCSPs and all of that. Is that part of the title protection piece?
I think it could be, but that's sort of a broader, it's not really title protection, but it does fall under our jurisdiction, because if you look at statute, one of the things that we're supposed to be doing is assessments to determine the function of the behavior and why the individual is engaging, which then makes the TCM practice of doing FBAs and developing a behavior intervention plan part of our scope of practice, right? So I don't know where, because they're not a licensed profession in Kansas. So what's the interplay there, David? Where you have, is that part of, they're not calling themselves behavior analysts, so it wouldn't fall under the title protection, but it's a group of individuals that are engaging in a practice that is within our defined scope of work.
And I would I would look first to see if they're under the carve-outs. That would be in that carve-out statute in terms
They
of
are
what
not.
and that could be something that we have some additional conversation on and maybe try to coordinate. I believe the targeted case managers are underneath KDAS, if I recall correctly.
They are.
That might be a good.
You and I had a meeting with, what was her name? Lee, I think it was, about this, but it continues to get brought up. The more cases that I'm involved in, as with like TCMs, writing PCSPs and BSPs, the more it becomes very apparent that it should not. They at least need to have some training as part of it.
And the two acronyms that Allison, David, if you're not familiar with them, that Allison just mentioned, the one is person-centered plan of care, and the other one is behavior support plan.
Okay. I've heard those terms, but I'm not as familiar with them as the rest of you all, for sure.
Yeah. And training for TCMs has been brought up at the upper echelons of the state and KDADs, but I think that's a topic worthy of continued discussion, because while they're not behavior analysts, they are engaging in what is defined within our scope of practice.
Do you know when the targeted case managers were created as a group?
I think they're older than us.
1989, 1985.
They're older than me, specifically.
Maybe somewhere back in the old days, when they first worked to deinstitutionalize the services for folks with qualifying conditions nationally. Really, they try to move people out of institutions into home and community settings. And it was probably around that time, which is, Pam, you may know this from an academic setting, and working in Lifespan Institute over there. Was that like in the 60s, 70s? It was a long.
I remember Jan Sheldon talking about it in my classes when I was there, but I don't remember the year.
Yeah. It was, I want to say it was in the 60s, but that was the origin of when they then decided that as they migrated people out of institutions, there needed to be some level of oversight, like who is going to develop plans for these people, who's going to help make sure that they have the support that they need. And that's where targeted case managers came in to play. And over time, it was their responsibility to develop those behavior support plans. But their training never kept up with their responsibilities, right? And now we have this whole new profession, behavior analysts, which it does fall within our scope of practice. And so now we have that overlap. And so yes, Allison, continue to bump that. Hopefully it'll get transcribed and we can put it on our meeting notes for things to discuss under new business, so it doesn't get lost.
Yeah, I had to double check the carve out statute because I was looking for the really specific language there. Because under KSA 65-50 or KSA 65-7503 B1, it says the licensing requirements, which would be the requirements to be licensed as a behavior analyst, would not apply to any person. Under B1, it says licensed by the board who practices any component of applied behavior analysis within the scope of such person's license and scope of practice as required by law. But there's a couple of reasons why they would not fit under that. A, they're not licensed by the board, and it wouldn't fit under their scope of practice. And so, they're not licensed by the BSRB. So it wouldn't fit under that. So I definitely think this is a good thing for us to have some additional conversations about and see if we can make some progress on.
Right. And then, and I also want to continue to keep open and maybe what we do is just talk about it a little bit at a time, or devote one whole meeting to talking about title protection for behavior analysts, because that has come up several times and it is not in our bill. And maybe what we could do is talk about, okay, if we opened up our bill, what could happen to this statute? What could happen here? What could happen here? What are some of the unintended consequences, so that we can, and maybe it would be that we decide to recommend to David and the board that we introduce a totally different bill instead of opening up the current one. I don't know if that's even a thing. Sometimes I make stuff up, so you guys have to forgive me. That's one of the things I just made up. But I don't even know if that's a thing we can do, right? So I think if we had if instead of leaving it as just one little line all the way down at the end of the agenda, maybe we can devote one of our meetings to a really robust discussion about reviewing our bill. What does title protection really mean? Is it worth opening up the bill, or is there a different avenue to afford title protection? And I think we're unique. I think we're the unicorns out in the world. But in this particular topic, other new professions have gone through this growth process. And I think that this is part of that growth process for us as a field, maturation. So, all right, with that, we're at 3:00 straight up. If anybody doesn't have any other burning topics, I would entertain a motion to adjourn.
So moved.
All right,
I can
thank you.
second that.
Thanks, Alec. All in favor of adjourning, say aye.
Aye.
Any opposition? Motion carries. Thank you, everybody. I want to say the one thing that I was going to say earlier and I couldn't do it is that, we're so blessed to have all you guys out there. I almost can't do it again. Advocating.
We appreciate you too, Linda.
Yeah.
So
We appreciate your leadership, Linda.
Thank you.
Keep it up, guys.
Thanks for
bye,
everything.
everybody.
All right,
Have a
everyone.
good week.
Bye.
Bye. Have a good weekend.